Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. Since this is our respiratory series, it wouldn't be right if we don't talk about airway management. And there are various ways of airway management, and they include oxygen therapy, suctioning, as well as tracheostomy care, TRICARE. So, oxygen therapy. So, it is used with various acute and chronic respiratory disorders to improve cellular oxygenation and prevent hypoxia and hypoxemia. So, what is hypoxia? Hypoxia is the deficiency of tissue oxygenation. That is the tissue not getting well oxygenated. And hypoxemia is low blood O2 concentration. Some signs and symptoms of hypoxia and hypoxemia include, so our early signs will be, remember, we talked about this early. First, we're going to compensate. So everything will go up. So tachypnea, tachycardia, restlessness, pale skin and mucous membrane, elevated blood pressure, and use of accessory muscle, as well as nasal flaring and adventitious lung sounds. And the late signs, we're tired. We've tried so much to compensate. The body is shutting down now. So what we have, bradycardia, bradypnea, confusion and stupor because that oxygen is very low, cyanotic skin, of course, and mucous membrane, hypotension, and cardiac dysrhythmias. Okay? So suctioning. So what is suctioning? It involves the use of a suction machine and the suction catheter to clean the airway by removing secretions. And there are various types of suctioning catheters. They could have a closed suction catheters, mostly seen with pediatrics. They have a Yanker catheter as well as a straight catheter, okay? The signs and symptoms indicating that somebody needs a suctioning or the patient needs a suctioning include restlessness, tachypnea, tachycardia, and decreased O2 saturation. You could hear some adventitious lung sounds like crackles. You will actually see visual secretions and absence of spontaneous coughing, like there's a block somewhere. And also, sometimes or all the time, good nursing care will be before and after chest physiotherapy. It will be good to suction your patient. Some nursing interventions when suctioning. So what do? Always perform hand hygiene. We don on appropriate PPE. Explain the procedure to the patient to help them relax, okay? So they're not fighting you. We obtain a baseline of breath sounds, vital signs, and O2 saturation. So you're not suctioning this patient, expecting the patient to have an O2 sat above 95 and their norm is a 93, okay? We position the patient in a semi or high phallus position to aspiration, right? Medical aseptic technique for oral suctioning and surgical aseptic technique for other tracheas. So we normally suction the trachea before the oral. So if you have only, one, but they normally have a trach catheter and an oral trach catheter, okay? So hyperoxygenate the patient prior, give them sufficient oxygen before, but if they have some blockage, it's not going to do any good, right? And then suction should be between 10 to 15 seconds. We rotated the suction catheter and we limit it to 2 to 3 pulses. Yeah, right? You put it in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, pull it out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, pull it out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, pull it out. Those are 3 pulses. And we always allow recovery or rest between the attempts, 20 to 30 seconds. So it's not like in, out. No, you got to give the patient some time to relax, reset, and then you suction them, all right? And we always, if you didn't document it, you didn't do it. So document the amount, color, consistency of the secretion as well as chest client response. So most of the time, if the patient goes back, return back to baseline, or if you're having like a choking sensation or patient is coughing, you will, indicate prior to in your nursing notes, patient not to be coughing, insufficient oral secretion elimination, client suction, client return back to baseline. You don't write it, you didn't do it. That's the rule of nursing. Our last airway management that we're going to talk about is a tracheostomy care, okay? And what is a tracheostomy care? We complete or render, complete or render trachea care in order to maintain a patient airway and optimal ventilation. It could be a pediatric or a geriatric patient. What do? We always explain the procedure to the patient, get them relaxed. We position the patient in a semi or high Fowler's position. We always have or keep an emergency bag by the client's bed with them at all times, right? If it's home care, the patient is going maybe to the mall, carry that emergency kit with you everywhere you go. Even if it's to the bathroom, it's with you. Why? In case of decannulation, you have everything you need. And in this bag, what do we have? We normally have the actual size trachea. So for example, the patient is wearing, if we're talking about an infant, is wearing like Bivona 4.0, right? That will be the actual size. And maybe their step down will be a Bivona 3.5. We need to have the Bivona 4.0 in that bag, a Bivona 3.5 in that bag as well, which is known as a step down, as well as a suction catheter and ties and scissors and tape. So what is the suction catheter for? If you're unable to reinsert the original size, we normally do a step down. So you try to insert a normal size, right? The 4.0. It doesn't enter. You reposition the patient. You try again. No. Put it aside. Insert the step down, which will be the 3.5. If you unable, reposition, try to reinsert. If we refuse, suction catheter and oxygen. All right? And we are calling for help, okay? With suctioning this client is PRN. It's not on a rotational schedule. It's as per MD orders. We always use surgical asepsis for trachea suctioning, as we talked about. We assess respiratory distress. We always start from the patient. If we have an issue, from the patient to the machine. Always remember that. And we provide trachea care every 8 hours and PRN. We change the trachea tubes. In infants, it's normally we are changing the whole trachea, and mostly they do it weekly to avoid infection and whatever. Or if they have a decannulation, maybe they will do a change, right? Or if they have a block, they will do a change because you need a patent airway. And for adults, most of them, they have an inner cannula. Before, they used to make you wash the inner cannula, but now they have the disposable inner cannula. So you'll just pop out the inner cannula, but the original trach remains. And it's normally done as per orders. And that's it for our airway management. Our next videos. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.